Can masturbation cause erectile dysfunction? It's a question that perhaps has crossed your mind at some point, but let's get this straight. Masturbation cannot cause erectile dysfunction. Yes, you heard it right. It is a myth. Masturbation is a natural process and does not affect the quality or frequency of erections. In fact, research indicates that masturbation is highly common across all ages. About 74% of males reported masturbating, compared to 48.1% of females. Surprisingly, masturbation even carries health benefits. According to Planned Parenthood, it can help release tension, reduce stress, and even aid sleep. Now you might be thinking, what if a person is unable to get an erection soon after masturbating? Well, that's called the male refractory period. And it's not the same as erectile dysfunction, it is merely the recovery time before a man can get an erection again after ejaculating. Now, let's dive into what research says about masturbation and erectile dysfunction. Universally, researchers are confident that masturbation does not cause erectile dysfunction. However, difficulty getting and keeping an erection either while masturbating or while having sex could be a sign of other conditions. It's important to note that age is the most significant predictor of erectile dysfunction. It is common in men over 40 years old, with about 40% being affected to some degree. Rates of complete erectile dysfunction, or the inability to get an erection, increase from 5% in men age 40 to about 15% at age 70. Other risk factors for erectile dysfunction include diabetes, being overweight, heart disease, lower urinary tract symptoms, and alcohol and cigarette use. But what about younger men? Although erectile dysfunction generally affects older men, a 2013 study found that as many as a quarter of men under 40 years old received a new erectile dysfunction diagnosis. In younger men, erectile dysfunction is more likely to be caused by psychological or emotional factors. Anxiety about sexual performance or erection quality can lead to further stress, sometimes creating a vicious circle. Factors that can contribute to erectile dysfunction in younger men include stress, anxiety, depression, post-traumatic stress disorder, bipolar disorder, or medications for these illnesses, being overweight, insomnia or lack of sleep, urinary tract problems, a spinal cord injury, multiple sclerosis, or spina bifida, having a high-stress job, relationship stress, and performance anxiety. In conclusion, masturbation is natural. It does not affect a person's ability to get or maintain an erection, and it cannot cause erectile dysfunction. While most men have trouble getting or keeping an erection at some point in their lives, frequent difficulties getting an erection is called erectile dysfunction. It's essential to learn more about erectile dysfunction and masturbation, understand if watching porn affects sexual function, and know when to see a doctor.